Hello guys, I hope you're well. Today we're going through Beclomethasone. So Beclomethasone is an ICS, it's an inhaled corticosteroid, and it's used in LABA sort of ICS combinations with a Symbicort turbohaler. And a very important point is when you have an ICS medication, it can cause thrush. So how would you treat thrush? You can give nystatin, you can give antifungals, you can use a spacer to reduce the prevalence. So ICS can cause oral thrush or oral candidiasis, and that's a very, very important point to discuss today. So when it comes to a DPI, what exactly is a DPI? So a DPI is a form of inhaler. So it's called a dry powder inhaler. And when you look at DPIs, there is a specific technique with it. So DPI is a breath activated. It's a breath actuated handheld device, and it's used in asthma and COPD. Very, very important point. And the way they work is they do not use any propellants or spacers. Then they necessitate a quick, deep and forceful inhalation, which you need a strong inspiratory force to activate the DPI. And that is a crucial point. So the breath essentially primes the release of a dose of medication as soon as the patient breathes in. So the medication is released only when the patient breathes in, eliminating the need to coordinate pressing and breathing. And this is a very, very crucial point. So it is recommended to rinse your mouth after use to prevent side effects as well. So a few forms of DPIs are Symbicort turbohaler, elliptors, easy halers, etc., etc. So some advantages of it is easy to use, no space required, no hand-breath coordination needed, eco-friendly, etc., etc. And yeah, a very, very important point is the fact that it is breath actuated. So DPIs typically require a quick, forceful inhalation. And you can imagine if someone is elderly, they may not be able to use a DPI. So this is not really suitable for people that are elderly or fragile. DPIs require enough inspiratory force to activate the inhaler. So that is a sort of a disadvantage, if you will, of how DPIs sort of work, and that's crucial to remember. So DPIs require enough inspiratory force to activate the inhaler, and that's very, very important. So if we look at type 2 diabetes currently, let's go through some information about type 2 diabetes. So type 2 diabetes is a metabolic disorder in which there is persistent hyperglycemia, which is defined as more than 48 millimoles per mole, 6.5%, or random plasma glucose more than 11.1 millimoles per liter. And this is very, very important because pre-diabetes is defined as 42 to 47 millimoles per mole, and diabetes is greater than 48. So 47 millimoles per mole is pre-diabetes, and greater than 48 is actual diabetes, and that's a very, very important point to go through. And thank you so much, guys.